Okay? So again, sternoclavicular joint, anteriorly palpate the clavicle up to you reach the point of the acromioclavicular joint. Now, next to that is the acromion. See? No. Okay? As you can see, this is the acromion. See? And under that is the coracoid process. Do you understand? Again, sternoclavicular joint, palpate the clavicle, and then you reach the acromioclavicular joint. Right next to that is the acromion. Under that is the coracoid process. You understand? Now posterior, place here. Back. Okay. No. No. Sit down. Okay. So, remove. Okay. So next is you have to check for the scapula. Okay? So where's the scapula? Here is the scapula. So check the supraspinatus muscle. Okay? Supraspinatus. Okay? Supraspinatus muscle. Now the supraspinatus muscle, if you go straight and follow the spine of the scapula, you will end up in the acromion also. Okay? So you palpate the supraspinatus muscle and then go through the acromion. You understand? Yes or no? Yes. Now, you palpate next is the bicipital groove and the greater tubercle. Face there again. Okay. So again, sternoclavicular joint, clavicle, acromioclavicular joint, acromion, coracoid process. Now this one is the bicipital groove. Okay, greater tubercle, bicipital groove. Okay, you understand? Now, you can ask him to do this, internally rotate, and you will feel what? The greater tubercle. You understand? Ask the patient to internally rotate, okay, to isolate the greater tubercle of the bicep or right. So there, bicipital groove, and then ask the patient to
Internally rotate.
passively and then palpate for the subacromial bursa and the subdeltoid bursa, which is not palpable. Again, the subacromial bursa and the subdeltoid bursa are not palpable. You're just checking for tenderness in that area. How do you do it? Stand up. Side. Passively extend and palpate. You understand? Here, you palpate. If there's pain, it could be subacromial bursa. Okay? Do you understand this one? Yes or no? Yes. Sit down. No. You don't go up. Again, sternoclavicular joint, acromio, okay? The coracoid process, okay? The bicipital groove, the insertion of the supraspinatus muscle, the infraspinatus muscle, and the teres minor. Okay? You palpate for tenderness in the subdeltoid bursa, in the subacromial bursa. Okay, range of motion. Okay? So you do stand up. Okay. Flex. How do you flex the shoulder? How do you flex the shoulder? No, just sit down. How do you flex the shoulder? 90, 180. Do it. 90, 180. Okay? Now, extend. How do you extend the shoulder? Side view. Side. See? Extension of the shoulder. Next, face. Abduction. 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 Next, adduction. Adduction. You understand? Yes or no? Yes. Next, internal rotation. So, when you do internal rotation is like this. You understand?
Yes.
Like this. So, how do you do it? Ask the patient to do like this. No, back. Show them. Internal rotation. Again, here, internal rotation. You understand? External rotation, how do you do it? Again, external rotation is this way. Right? Again, internal, external. So how do you do that? Abduct. Okay? Like this. Do you understand? Yes or no? Yes. Follow? Like this. Okay? Internal and external rotation. Do you understand? Yes or no? Yes. Maneuvers. Sit down. No. We have to make the plus 10 worth it, right?
Yeah.
Apply scratch test. Now, if you want to do all of the, what's this? The maneuver, the range of motion in one maneuver, you call it the apply scratch test. Okay, you want to test all the range of motion in one maneuver, it is the apply scratch test. It tests the overall shoulder rotation. A positive sign is difficulty doing it, suggestive of rotator cuff injury or adhesive capsulitis, which is what? A frozen shoulder. Have you heard of a frozen shoulder? Yes. So how do you do it? Okay, see? Apply scratch test. Okay? Do you understand? Oh, we will dissect it one by one. Stand up. Stand up, my friend. Okay. Now, as I told you, you will test all the range of motion. So, flex, right? Flex, externally rotate. Flex, abduct, externally rotate. Do you understand? Now, do it. Flex, abduct, externally rotate. Do you understand? Yes. Now, the other one, extend. First, internally rotate. Extend. Right? And then abduct. Here. So, looking at the back, that is the apply scratch test. Testing all the range of motion in one maneuver. Do you understand? Yes or no?
Yes.
Yes. Next.